Well, the project centres around exploring alternatives to making complaints and raising issues in care. And also examining maybe what's good about complaints and what was bad about complaints, and getting people suggestions on how they think things could be improved.
Where did this idea about the complaints and the challenges around that just develop from for you personally?
For me, I think I have been a long-term patient for 40 years, and there will be things that go wrong in care at times, and I was once given the wrong drug.
Right.
So, but it was all sorted out very, very quickly, and staff moved in. They were very, very open about what happened. There was great transparency, and there was actually learning. I know there was learning gained from it, and the whole thing was sorted out in 3 weeks. And then another time, many years later, there was a problem with care in a completely different area, and I was just told, go make a complaint.
Okay.
And I just felt this was not suitable. It was not a suitable topic to become involved in. Complaints process was too clinical, it was too complex, and it could have caused more harm than good, and it caused arguments that were unnecessary, where I had always said I don't want to make this complaint. At the end of the day, what happened was, in the time that I had available, we actually created a poster which will be used as a tool in the future for other work. The poster has been used for an event in the non-acute sector and has been put up on display in the non-acute areas. Hopefully that it will be spread around the hospital and other areas as the time goes on.
Did you encounter any difficulties or any challenges that might have put you off to begin with, or were you able to work through them okay?
It was all quite new to me.
Yeah.
And you look at everything, you think, no, this is going to be okay because I'll find out how to do things as with each step. But then you start looking and think, what's that? But it does. You work your way through it, and you learn from it, as you go along, and then you realise this does really work. I felt it quite intense the way because there was so much detail in it. But at the end of the day, it got where I wanted to go, and easier rather than just, as I say, jump from A to B without anything in between, because people wouldn't have taken that maybe as seriously, and I could show them the analysis of what I had, which people seem really, really like, and that's why this next move is coming on. There are plans now to create the co-design group, but that's based on the analysis of the data from that course.
What's next for this project, if you want to maybe elaborate a wee bit on that?
Getting other ideas, because not all my ideas are going to be, they're definitely not going to be perfect. They can be improved upon. Other people might have better ideas. I think what came out of this course was that there needed to be more communication and information and early intervention, and those are main messages that are going to come through in the next stages, I would imagine. As will a more personal public involvement approach and more partnership work, and we hope also to build on the work carried out so far in the study to explore more ways of look at the more human side of raising issues in care and the complaints process and the impact it has on all stakeholders, on staff and on patients and on carers. The abstract for the work has been accepted for the forum for quality and safety in healthcare in Glasgow the end of March. So I'm really pleased about that and hoping that raises some good publicity for the work behind it.